Up, guys.
All right, Brooke, thank you. The potentially historic House session today to decide the fate of the health care overhaul isn't just one vote, but three. The first will be on a rule to establish debate guidelines. The next will consider a package of changes to a Senate-passed bill, including deletion of special Medicaid benefits for Nebraska.
Finally will come an up or down vote on the bill already approved by the Senate, which has been the focus of intense national debate for months now. After building for more than a year, emotions over the vote extremely high. Lawmakers know that their political lives on the line. We're going to now talk with one of those lawmakers, Congressman Brian Bilbray, Republican from the 50th District, joins us live now. Last hour you said Democrats don't yet have the votes. Is that still the case now?
As far as we know, there's still two, and they're meeting. There'll be a meeting about 12:45 to get the update of what's going on. But with this rule, they basically have been able to force that we actually have a vote on this bill. I mean, this bill that is supposedly the Senate health bill is actually and very interesting that even the title is sort of a misnomer. It's the official title of it is the Service Members Home Ownership Tax Act, which has nothing to do with health care. But what they did is they hijacked the Veterans Bill and actually gutted it and then added this in there. So we're going to be voting on not just what we'd like it to be, but we're going to be voting. That third vote will be yes or no. Do you go along with the Cornhusker backroom deal, the Louisiana, the Florida, all of these senators' backroom deals? We're going to have to vote either yes, we're for that or not. Even though we may have voted that we'd like those things taken out, we haven't taken them out. They're actually going to be an up and down on all of those Senate deals that everybody is so upset about.
Well, Congressman, what is the mood like right now for the Republican Party? You've been back there, and obviously we've interviewed you several times about this intense topic, this intense battle that we've seen unfolding in our country for many months now. What is the mood of Republicans if this does pass today, if the vote happens?
Hey, look, I think Paul Ryan said it very well. He said this is a huge political advantage to the Republicans. But like Paul said, I'd much rather do without the politics and protect my children and grandchildren from the huge impact that this bill is going to have on their lives. I think we're scared to death that we're going to see something pass that cannot be changed within a generation. Because remember, it's not like a city council vote where you get a simple 3 or 5 votes and you can change it. This means that you have to get 60 votes in the Senate, you have to have a president that agrees, and you have to get a majority in the House. And that is something you only see once a generation. So if this bill passes, don't anybody tell you, oh, don't worry, we'll be able to go back and tweak it. The fact is, it is just like what happened with welfare reform. It took almost 40 to 50 years to get that straightened out. And you and I will be in the grave before we'll see this one straightened out if it passes today.
Congressman, health care reform has been something that Democrats have been trying to do for several generations now. They've built up these big majorities in the House and the Senate, and they've been talking about health care for years. Don't elections matter? Don't elections have consequences? Isn't this what majorities are for?
Well, absolutely they have. But when you give such huge majorities, this will be the first time that we have seen a bill like this pass with no bipartisan effort. You got to remember, Medicare was a Republican-Democrat vote. They were working together on that. This one is totally one party that has been given so much power that it doesn't even have to allow the other party in the room while they're putting this together. So that's where you get all of these backroom deals get involved in here, because you got one side that would keep them honest, not even in the same room. This is extraordinary. I cannot, as a history major, I can't go back and tell you at any time in the Republic where you've had a major piece of legislation like this bill passed without any participation at all from one side of the party, just because the voters did. They gave the Democrats the power to dictate, and now they're using the crisis that we have in the economy as an excuse. And look, the words were said from the chief of staff of the president: let no crisis go unexploited. And I think American people are very upset, mostly because the cynical thing of let's exploit this and let's try to cut backroom deals. And as Californians, we didn't get a good deal on this. Everybody else was getting a piece of a slice in Nebraska or Florida or in Louisiana. But Californians are going to have to pay higher taxes to cover those backroom deals.
All right. Well, Congressman, thanks so much for joining us and sharing your views. Obviously, Democrats do not necessarily agree with what he had to say. We're going to hear from a Democrat coming up at 9:30. Congresswoman Susan Davis is going to join us to get that side of the perspective. But Congressman Bilbray, thank you for joining us.
Thank you very much.
Thanks so much, Congressman.